Hello everyone, good morning, good afternoon, and good evening. Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life you absolutely love. I'm your host and coach, Fletcher Ellingson. Amy will be joining us in a few minutes to talk about a subject that is sure to pique the ears of men listening, because we're going to be talking about ED today. What causes it, who's at risk, and what can be done about it. So listen up, men. Remember, health is the first wealth, so stick around. As a reminder, if you have questions that you would like us to address on or off the air, you can send them directly to me at fletcher@fletcherellingson.com. Okay, let's get to today's email from Angie. It says, "Dear Fletcher, I don't feel like I am fairly compensated at work. I show up on time, I don't take a lot of time off, and I'm rarely sick. I perform my job well, and I feel like I'm a team player. The issue is I hardly ever get a raise, and there are other people who are doing the same job and making more, and some of them don't do as well as I do. I want to be paid more, and I feel like I should, but I don't know how to ask for it. I feel more and more upset and resentful about it. What should I do? Thanks, Angie." Well, Angie, first of all, way to be in action and get some advice. Strong people ask for help. Now, without knowing all the details, here's what I would suggest. First off, many businesses have a review and a pay raise structure in place. It may or may not be advertised within the company. So find out if yours does, and then you can operate within that structure to ask for a raise. It may be during an annual or semi-annual review, or it may be based on performance or some other metric. But if they don't have a structure in place, you're going to need to create a time to meet and ask for that raise. And one way to do this is to ask for a performance review. You can use that time to discuss your performance and ask for that raise. It may also be a time that you can discuss advancement, if that's something that's important to you or that you want. All of this is within your rights, and your employers understand and expect this from their employees. So, if as you said, others are making more than you for performing the same job, it's likely that they've already had these conversations with their employers. So now, it's your time. You see, even though a business may say they offer regular raises, they may simply wait for the employee to ask for it. Many employees are too timid to ask for a raise, and that ultimately benefits the employer. Now, if you feel as though you're creating value at your workplace, then ask for the compensation you want. Also, I understand this can feel uncomfortable, so I suggest that you role play this with someone. Go through it, 6 or a dozen times even, so you feel more comfortable and the prospect doesn't seem so frightening. Role playing can be very useful. I use it at times when I have to have conversations about which I feel uncomfortable. And then it's also okay to script your words so you can ask exactly what you want for without getting all tongue-tied. Now, keep in mind, they can always say no, or they can make a counteroffer. If they do say no, you can make a counteroffer, or at least request to know when you can expect a raise and put a plan in place so you both know when it will happen, and that will give you some peace of mind. Now, if you have continued to bring value at your company, they're likely going to say yes when you make that request, because they want to retain quality employees. It's much more expensive to have to hire somebody new and train them. But again, know that they're watching their bottom line too, and so they may not give out raises unless they are requested by the employees. And I understand it can be scary, and you may worry about being rejected. Well, I want you to know something. I want you to understand that if they say no, they're not rejecting you. They really are not rejecting you. They're just rejecting your request. And that seems that can be a hard concept to get your mind around. So let me give you an example. If you stand out on a street with a box of kittens, let's say, and you offer free kittens to people that are walking by, what are most people going to say? They're going to say no. They may even stop and hold the kitten and think about it, but most of them are going to give those kittens back to you. But when they do that, you don't feel rejected, do you? Just because they said no, you don't feel rejected because you understand that they're saying no to the offer and not you, right? They're rejecting the offer. They're not rejecting you. You would also understand that it doesn't make sense for that person at this time to take home a new pet. It may not make sense for them financially. It may not make sense for them because they don't have enough space, or they may have an allergy to it, or they may live in a place that doesn't allow pets. So it's the same with your employer. If they say no, they're not rejecting you. They're just rejecting your request for various reasons. And if you really consider this, it'll make it easier for you to make that request. Because if they say, they're not rejecting me. Now, one last thing. Just think if they do say yes. How will you feel? And what will that mean for you? What will that mean for your bank account? What will that mean for you to have the ability to maybe pay off some debt, or save extra money for a vacation, or put money towards tuition? I want you to create a vision of them saying yes. See it happening, and really get in tune to how that will feel, because that's going to make it easier for you to actually go and make the request if you're focused on them saying yes and focused on how good that will feel. Because what you focus on creates emotions in your body. So focus on them saying yes. And finally, I want to say to you, Angie, what do you have to lose? Nothing. And what do you have to gain? Well, a raise. So go for it. You can do this, and I believe in you. Okay, we are going to take a short commercial break. Stick around because we're talking about ED, who's at risk for it, and what can you do if it happens to you. Hey everybody, welcome back to Live It Up. We are here with Amy. Hey Amy.
Hello.
How you doing?
Good.
Excellent. Tell us what we're talking about today.
We're talking about erectile dysfunction.
ED.
Yes, ED.
All right. Now it may seem obvious to you, but what do doctors mean about what does that mean?
Yeah, I think that men actually are not clear on what this means either, so it's a good thing to clarify. So erectile dysfunction literally means that you have that a man has the inability to get and keep an erection that is sufficient, firm enough to have intercourse. And intercourse meaning like all the way to be able to complete the act of intercourse. So a man may still be able to get an erection, and he can still have ED if the erection isn't firm enough to complete intercourse, or the erection is not maintained for the whole time. So that all of that falls under the category of erectile dysfunction. And if it's something that happens on occasion, once not very often, or after someone's had alcohol or been really tired, then it obviously doesn't mean that you have erectile dysfunction. It's if it's something that happens in a recurrent manner.
Got it. Is this something that men seem uncomfortable talking about?
Uncomfortable?
Yeah.
Yes.
Okay.
Yeah, it's not something that men seem to look forward to talking about, at least not with me. Maybe if they saw a male doctor, it'd be different, but they're usually a bit embarrassed, and then they're a bit embarrassed about the questions that I may ask them back. In medicine, we have something that we call a doorknob question, and that means that literally our hands are on the doorknob ready to leave the room, and you hear from the side like, oh, I have one more question, and you usually, if it's a man, I usually know it's going to be this topic, and it frequently is. So men aren't very comfortable talking about it, but it affects about 30 million men in the United States, so it's very common. Mm-hmm. And I would hope that once a man brings it up with their doctor, they realize that we're very open and willing to talk about it, and we're not going to, make it be more embarrassing for them. And so hopefully they can, once they broach the subject, they can feel comfortable talking about it.
Yeah, I can imagine some people might feel embarrassed or ashamed about it, and so it's a pretty sensitive topic.
Yeah.
What are the different causes, and why does it tend to happen in the first place?
So yeah, the male sexual arousal is what we would call it in medicine. It's a complex process that is going to involve your brain, hormones, emotions, nerves, blood vessels, and muscles. And so erectile dysfunction can happen at any of these levels or a combination of them. And so if someone has an underlying condition, or they might have mild ED, and then something stressful or emotional happens, then it really makes it worse. So some of the physical causes, there are many of them, but one main one is blood vessel damage, inflammation, or damage to the arteries stemming from high blood pressure, high cholesterol, smoking, diabetes, poor diet. We've talked all the stuff we talk about, which is lifestyle related, which is causing so much chronic disease in the U.S. So erectile dysfunction, it actually can be an important early sign, especially if someone's young, that they're already developing artery inflammation and damage. High blood pressure medications are a common cause. So if for some reason your doctor starts you on a new medicine and then all of a sudden you have an issue with your erections, it's likely not you, it's the medicine. So you can talk to your doctor about that. Low testosterone levels can lead to inadequate erections or infrequent erections. Obesity, metabolic syndrome, which is a pre-diabetic state, Parkinson's disease, multiple sclerosis, those would both be neurologic causes. Other prescription medications for depression is another common one. Some of the depression medications that we actually use to improve premature ejaculation, so the opposite can happen. If you're on a medication for depression, which millions of Americans are, then it can lead to the inability to ejaculate or have orgasm. Smoking or tobacco use, like I mentioned, alcoholism. Another one that's pretty common is if a man's had their prostate removed, they can have erection issues afterwards.
Okay.
Oh, and I mentioned to say, psychological causes. So I think a lot of times men think, well, somehow their testosterone will just, it can combat anything that they're going through emotionally, but it's really not true. So if the relationship is suffering, you're not feeling close to your partner or something, or you're in a fight or something's happening, or you have underlying depression or anxiety that's not being adequately treated, or there's a lot of stress or fatigue, then that can impair normal erection.
Okay, so there's physical and psychological issues to consider.
For sure.
The men that we see in the commercials, there's all these commercials now,
I know.
They're all a bit older. So is it inevitable that this is going to happen to every man as they age?
It's definitely not. So many men are just fine, even in their 70s and 80s. So the studies would suggest that about 5% of men at age 40 have erectile dysfunction and 15% of men in their 70s. So you're still talking, vast majority of men that still should be fine in their 70s and even 80s. And because it's not just getting older that's a problem, it's also the fact that, like we've talked about, is being older makes you more likely to have high blood pressure, diabetes, heart disease, so blood vessel damage. It makes it more likely that you're going to be taking medications for one of these issues. So it's not just the getting older, it's all the other comorbidities that happen. So it's really important to keep in mind that if you want to maintain your normal sexuality into your 60s, 70s, 80s, that you really need to focus on keeping your nerves and blood vessels healthy so you can maintain that.
Okay.
I would say that those commercials my daughters find very embarrassing.
Well, good stuff. We're going to take a short break, and then we're going to come back and learn more about ED and what to do about it, right?
Yeah.
All right, stay tuned. Hey, welcome back to Live It Up. We are here with Amy, and today we're talking about ED. And aside from stopping the aging clock, is there anything a man can do to prevent this from happening?
Yeah, for sure. But you do need to start young. I mean, you really need to start paying attention to making sure you don't have the issues that are going to make you have a problem when you're in your 30s, really.
I want to back up one. You just reminded me of something I want to back up. What's the age range of this occurrence, or when can you begin having this? I mean, young men don't get it, right?
I don't think I've had a patient probably younger than 45, but even in your 40s, but I mean, I guess that's not true unless it's medication induced. But if it's from blood vessel issues and it's not surgical or medication, then it's usually not going to be until you're in your 40s, 50s, which is about the same age of men start having heart attacks and that kind of thing.
Okay.
Yeah. So working with your doctor to reverse or improve any of the issues that cause blood vessel inflammation. So diabetes, high cholesterol, high blood pressure, any other chronic health conditions. So any, again, like I mentioned earlier, if you're someone who's less than 50 and you're having issues with your erections already and it doesn't seem to be an emotional thing or a medication thing, then it's really a concern that you're developing inflammation and damage to your blood vessels, because an erection is a blood flow phenomenon mostly. And if you're not able to get the blood flow, that can be because of blood vessel damage. So meaning especially if you're a smoker, you need to stop smoking for so many reasons, but that's a huge cause of erectile dysfunction is smoking, because smoking is very, very damaging to your arteries. Excessive alcohol is also a big cause of erectile dysfunction. So really, stopping or limiting alcohol, definitely stopping smoking, making sure if you have diabetes, reverse it now when you're younger, reverse your high blood pressure if you can through lifestyle changes, get good exercise, reduce stress. If you have anxiety or depression, get help for that, and then talk to your doctor if you're having any issues.
Got it. Wow. I assume the treatment depends on the cause, so can you address that?
Yeah, so the most common treatment would be the medications that we see on TV, which I'll talk about in a minute. And that really helps with the blood supply issue, or the blood flow issue, because that's mostly what determines the strength of an erection. If there's a nerve problem, which can occur after a prostate surgery or some other reason, there are lots of options. There are implants and pumps and injections and all kinds of things. So really talk to your doctor or your urologist about options. You don't need to just suffer in silence over this.
Okay. What are the TV ads selling?
Yeah, the ones that embarrass our family.
Yeah.
Right, so the TV ads are usually for Viagra, Cialis, or Levitra, and those are the main three medications that end up dilating the blood vessels to improve the blood flow, and so then that thereby improves erection. So about 7 out of 10 men will have improved erections with these type of medications. The difference between those three are really just how long they last in your body. So Viagra is about 4 hours. Cialis can last, even over a day or a couple days, where that can be active in your body and give it a bit more flexibility. The medications, all three of those medications are really expensive. Insurance companies do not cover medications for erections. But the cool thing is, for about a year now, there's a generic form of Viagra. It's not the same dosing that's used for erectile dysfunction. It was actually released as a generic for a lung artery condition. And so the milligram strengths are a little bit different, but it's much less expensive. And so if you asked your doctor for a sildenafil or generic Viagra, you may need to take, it's like 2 to 5 pills versus the normal dosing for Viagra pills, but it is available.
Okay, and check with your doctor about it.
Well, obviously, yes.
Yeah.
Don't buy anything on the black market or from Mexico or Canada. Talk to your doctor.
And so you're saying insurance doesn't cover this, so
Nope.
This is all cash pay?
It's all cash pay.
Dang.
Yeah, so again, it really helps. It really makes a huge difference to prevent this issue rather than try to treat it.
So if a young man is having this issue, or a younger man, that's going to be an alarm, a sign that something is going on that's much larger than, okay.
Or can be.
It can be, yeah. So wasn't the ingredient that was originally, or used in Viagra, wasn't that originally for something else, and they kind of accidentally found out that, this works for that too?
Yeah, and so Viagra, I think, celebrated their 20th anniversary in 2018. And so the researchers were studying, I think it was over in England, and they were studying this medication because it dilates blood vessels. So they were looking at it for high blood pressure and angina or chest pain. And they just was a very welcome side effect that the men reported, that they had, significant improvements in their erections, and that's how it was found.
Okay. So they seem to be pretty popular. Are there any side effects to these medicines?
There are a few, but not many. So the one biggest precaution people have to take is that you can't take nitroglycerin while you take any of these medications, or while they're in your system. So that's a really big precaution.
And where would you find nitroglycerin?
Oh, well, nitroglycerin, some people are on it every day for certain heart conditions, and then other people would take it just if they needed to, if they were having signs of a heart attack. So it's just something you would need to clarify with your doctor if nitroglycerin is on your medication list.
Got it.
And otherwise, a headache is going to be the most common one that you'll find, again, from the dilating blood vessels. It's not dangerous, but it can be, annoying. Stuffy nose, facial flushing, sometimes indigestion, and then rarely Viagra can cause a blue-green shade to the vision that is temporary.
Weird.
Yeah, I've never had anyone tell me they have that happen, but.
That's wild. And what about, and then how long does it last?
Well, it just depends on which one.
The Viagra. I mean, like you
say
you
the
take
Viagra
a
lasts
pill,
4 hours.
It takes 4 hours.
Yeah, it lasts 4 hours. So you have a 4-hour window to be sexually active.
Got it.
Yeah.
Interesting.
The other ones last longer.
So what about women? Do they ever use medications? Because I don't ever see like commercials for women.
Well, Viagra is not FDA approved for women, and sexual dysfunction in women is very different than erectile dysfunction. So Viagra or medications like it could, theoretically can help improve the female sexual experience, especially in postmenopausal women who have less blood supply to the vaginal area. But it's not been approved for, it's not really been studied for this case. So you could talk to your doctor about it to see if you're a candidate. I don't have any experience in using it in women. I have other things that we do, not that.
Okay, so it's not as common experience or issue for women.
Well, no, I wouldn't say that. I mean, female sexual dysfunction is very, very common for women, more so than in men.
Oh.
But it's a completely different topic. So like I mentioned, that the human sexual response, involves the brain, hormones, emotions, nerves, muscles. So female sexual dysfunction is super common. But whether you're talking about, lack of orgasm or desire or vaginal dryness, painful intercourse, it's a very complicated topic for women. It's a topic for a whole nother show. And women, there are lots of things to do about it. So for a man, say you could take Viagra, but I have a lot of men who are married to older women, and they say, well, gosh, it's not any fun for my wife anymore. It's uncomfortable for her, so that's no fun for either one of you. So there's help out there for sure.
Got it. Okay. Is there anything dangerous associated with ED?
Well, just like I said, especially if you're younger than 50, you really need to take precaution that it may be something that you're having damage to your blood vessels.
Okay, good. Well, we're just about out of time, so good stuff. Very sensitive topic for men for sure, but hopefully if this was helpful to you. If you got any of these symptoms, go see your physician. Don't be embarrassed or ashamed. And now it's time to get out there. Be a source of kindness, be a source of contribution. You matter, you have something to offer this world, and I believe in you.